Hey there, MedCosmos here. Today, let's understand the JVP, also called as the jugular venous pulse. The JVP is a physiological waveform that is seen in the internal carotid artery. Any alterations in this physiological waveform gives us an indication as to the underlying cardiac conditions that a patient might be suffering. So let's dive into it. The first wave that we see is called as the A wave, which corresponds to the atrial systole. So during atrial systole, which occurs in the last part of the diastole, about 30% of the blood enters into the ventricles. So whenever the atria contracts, this causes an increase or a positive deflection of the JVP. The next one is the C wave. The C wave corresponds to isovolumetric contraction, also called as contraction of the ventricles in the closed chambers. During this wave, there is upward bulging of the valves because there's increase in the ventricular pressures but in a closed chamber. This upward bulging of the valves produces the positive deflection in JVP. The next wave is the X wave. It corresponds to the atrial relaxation, which in turn corresponds to ventricular systolic phase. During this ventricular systole, there is ejection of blood into the pulmonary artery and the aorta. That causes the downward deflection of the already bulging valves, and this produces the very first descent in the JVP waveform. The next one is the V wave, which corresponds to venous filling against the closed valve. So there is venous filling from the SVC and from the IVC. This bounces off across the closed valve, and this is what produces the positive deflection in JVP. The last one is the Y wave. The Y wave corresponds to emptying, where there is rapid emptying of the blood from the atria into the ventricle. About 70% of the blood empties out, and during this rapid emptying phase, there's a sudden fall of pressure, and that is what corresponds to the Y descent of the JVP. This JVP can be analyzed bedside by putting the patient at 45 degrees with the horizontal and measuring the elevated JVP from the sternal angle of Lewis. If this elevation is less than 4 centimeters, it is considered to be normal. Now, it's very easy to get confused between the JVP and the carotid, which are present in quite close proximity with each other. So how do you differentiate them? JVP is better seen, unlike carotid, which is better felt. Carotid is with a single peak, unlike the waveform that we see in JVP. And the most important one, JVP falls with inspiration, whereas carotid has no such change with inspiration. And with that, we complete the JVP. Thank you. Bye.